to this first session of the monthly series, speaker series of the G4 Alliance, put forth by this G4 Alliance Latin American, the Caribbean Working Group. Honestly, the intent and the desire for this ongoing forum is to make sure that all organizations get a chance to really understand the work that is being carried out, and together we get to really become closer as an alliance, and also inviting our friends to sharing some of the lessons and experiences of so many of the permanent council members of this organization. Before I begin, I do want to thank Jody, who's the chair of the Latin American and the Caribbean Working Group. Jody Grohl, she's taken the difficult task of doing the simultaneous interpretation. So hello, Jody. Thank you so much for doing this, and also for leading this group into coming up with some of these activities that are so constructive and positive. Today, we have a fantastic speaker, but before we go into the session, I would like to welcome our dear friend Michael Neveker to present today's speaker. And many of you already have worked with Michael. I know Michael, but it's important to highlight he's not only the current president of Mobile Surgery International, but someone who's actually spent over 2 decades working in the humanitarian assistance, and has really utilized his expertise in fundraising and advocacy and in project management to advocate and support programs really throughout the world. He, in addition to English, he speaks Thai and Chinese, so it's perfect for working in Mexico right now. As you can imagine, so we'll put his Spanish to practice. But Michael, thank you so much for your work. Thank you so much for, obviously many people know Michael because of his efforts in the U.S. government working group, and those of us who know him can attest to the fact that if he sets his mind to something, he's going to get it done. So persistence usually pays off, and caring. So Michael, welcome, and would you please introduce our fantastic speaker for today?
I will. Thank you. Thank you, Ruben. Thank you very much. It gives me great honor to present Dr. Sierra today. Dr. Nicholas Sierra is Associate Surgeon at the Pediatric Oral and Maxillofacial Surgery Unit of the Vall d'Hebron University Hospital in Barcelona, Spain. He is our Medical Director and Chief Surgeon for Mobile Surgery International at the Mobile Surgical Center in Oaxaca, Mexico, where a model for comprehensive surgical care for cleft patients is under development, with the support of our trusted partner, SmileTrain. Dr. Sierra has dedicated his entire career to the management of congenital face anomalies and humanitarian care for the neglected surgical patient. He started his training in cleft surgery with Operation Smile's Cleft Surgery Training Program at the Guwahati Comprehensive Cleft Care Center in Assam, India. Dr. Sierra completed his Cleft Craniofacial Fellowship at the Plastic and Reconstructive Surgery Department at the Federal University of Paraná in Curitiba, Brazil. He serves as a volunteer for Operation Smile and has participated in numerous international programs, including the Humanitarian Orthodontic Surgery Program within the organization. It's my great pleasure to introduce Dr. Sierra to you today.
Thank you.
Nico, take it away.
Thank you, Mike, and thank you, Ruben. Thank you, all the audience and all the G4 Alliance members. For me, it's like I feel surrounded by family here, with Ruben and Mike there. I feel like I am really, really warm. So thank you for having me. And so I'm gonna get started. I'm not very efficient on the use of technology, so let me get here. Okay. So oops. So can you see my screen?
Nico, one thing before you begin,
okay.
I would say it is truly a privilege to have you. And for those of us who know you, you're probably one of the kindest, most humble individuals. So I'd love to really celebrating someone like you. And you have an audience that is very friendly, eager, and willing to listen. Voy a cambiar a español y yo creo
mira,
que
se me olvidó.
fue mi culpa al inicial en el inglés,
Perdón.
pero cambiamos al español para lo de las...
Now I'm going to switch to Spanish.
Sí, me olvidé. Me olvidé por completo y bueno, mucho mejor. Ustedes llegan a ver bien.
Yes, this is much better. Can you see my screen? Yes.
Perfecto. Bueno, hoy queríamos compartir un poco
We wanted to share a little bit the experience of our Mobile Surgery International Group in the activation of patients with cleft palate in Oaxaca, especially how we've restarted during the pandemic. I want to dedicate this conference to one of my great teachers who left us this year, but they continue present at my side. Two doctors who continue to be at my side. I'm going to share a video. It is subtitled in English, I believe English and Spanish. So you may want to raise your volume. So we're going to play the video. Let me share this video. And it's subtitled in English.
Is a nonprofit humanitarian organization that was created to alleviate suffering of children born with neglected surgical disease, like cleft lip and cleft palate.
Mi trabajo como cirujano consiste en devolverle a las personas, a los bebés, la funcionalidad a la cara, a su boca, a su nariz, para que puedan comer de forma normal, hablar de forma normal, escuchar, para que puedan comunicarse, para que no crezcan con una discapacidad.
MSI and AMS share a common vision, and that vision is to help global health around the world. There is so much need. There is neglected surgical diseases all around the world. I'm impressed. This is a beautiful campus here in Oaxaca, but it's only one. We need 20 more throughout Mexico. We need dozens and dozens throughout Asia and throughout the Middle East. We have a huge opportunity and responsibility.
Está muy bonito, está muy bien, está súper bien, es muy limpio, seguro. Yo invito a todas las personas a venir a este lugar, que aquí les ayudarán y sobre todo que no es sin ningún costo para todas las personas de bajos recursos, y esta asociación apoya a hacer mejor la vida de las personas con estos problemas de la paladar.
Dar soluciones a todas aquellas personas que con deformidades faciales en todo el territorio de Oaxaca necesitan una valoración, necesitan cirugía y necesitan sobre todo acompañamiento y seguimiento para poder lograr los resultados que nosotros buscamos.
Voy a continuar.
I'm going to continue with. This is a video that summarizes a little bit our organization. I will introduce you to part of our team, Mobile Surgery International in Oaxaca. And we're going to talk about our general strategy, working within a city affected by the pandemic, how we return to surgery, and how we've been able to do elective surgeries in this pandemic. Oaxaca is a state in the southern part of Mexico. The total area is similar to the size of Portugal. The total population is similar to the country of Panama, about 4 million. El índice por cápita es muy baja. Es un territorio. It's very low. It's a very impoverished region. Many are native populations, communities, including many pre-colonial era languages. It is also a very mountainous region. It can take more than 15 hours to get from the capital city to the borders of the state. The Children's Hospital in Oaxaca only has 3 ORs and about 70 beds. It's a very impoverished state. Around 80% of the population doesn't have any Social Security. They do not have access to sufficient nutrition. 17% have no access to any health services. It's a very impoverished region of Mexico. Here you can see it compared to other parts of the country. It's one of the most impoverished regions of the country. There are multiple barriers to access to health. One is geographic. It's very difficult for many families to reach the locations of healthcare. Many possible patients can't leave their homes because they need their family. They can't leave their families to travel to where they get health care. There's also cultural disconnect between the cultures of the population and the types of health services. There also is limited quantity and quality. Now, speaking of human resources, very few healthcare workers for a population of this size, for 40 million people. And access to training for specialties is very limited. So access to care is they're very split, very atomized, the different types of specialties. The estimated need for cleft palate and lip repair and this is so we know that there are more than 2,000 patients who have cleft lip and palate. And of those who have been operated, 90% have suboptimal outcomes. So even though they may have been cataloged as operated, they have not received an adequate repair. So we think that approximately 100% of our patients are going to need additional procedures, even those who've already been operated. Where did the Mobile Surgery International model come from? We need to recognize the work that has been done previously by the two large organizations in this field, Operation Smile and Smile Train. And they have two different models. Operation Smile is very advanced in the mission model and doing campaigns where they do a high volume have a high
la calidad y la continuidad del tratamiento.
so the biggest challenge for Operation Smile is in the quality and in completing the whole process. Smile Train has a different model, doing more a long-term approach, and providing long-term continuous care with including secondary treatments. Their challenge is more surgical capacity. And then MSI has pulled on distinct models from Europe and other areas that have drawing on experiences of different organizations that have done work in cleft lip and palate. And so they've looked at these different models to see what approach to use. The very interesting study was published by the John Mira Group to try to sketch a new model, a diagonal model, a humanitarian approach. And that has inspired Mobile Surgery International. So again, we have looked at many different approaches, many different paths that have already been followed, drawing from them. Also taking from the Lancet Commission. And also from the Gujarat Center in India, where I received training. So Mobile Surgery International proposed a strategy working with the local public health sector in Oaxaca, and also working with Smile Train, but bringing a up-to-date, state-of-the-art infrastructure. So again, it's really important that we're not just talking about primary surgery cases, but also the secondary treatments, students who are patients who have already received surgeries and need new surgeries. We do not have a short-term approach. We know we have to have a long-term view of the work we need to do. So Mobile Surgery International is very much based on its unique infrastructure, as you can see in the video. Our state-of-the-art, latest generation mobile unit. There are 10 stations for pre-op. And there's an OR with two OR tables. And then there's a post-anesthesia also with 2 spaces. And then 10 post-op beds. So this is a latest generation infrastructure. It's also very versatile and adaptable. That can really raise the surgical capacity of the location where it's placed. And this helps us to do a medium-term expansion of surgical capacity to address the need in a location. We also hire local, very highly trained healthcare workers.
Staff permanentemente vinculado de forma diaria y contratado con el equipo. Nos enfocamos en el acceso, en facilitar el acceso. Traemos todo lo aprendido con Operation Smile desde el punto de vista.
We bring everything that has been learned with Operation Smile.
La calidad y la capacidad que viene de la experiencia de poder hacer cirugía.
And that brings a lot of experience and capacity. and how to do surgery with a team.
Inclusivo a todo tipo de pacientes de todas las
and
edades.
also inclusive of all types of patients who come to us.
La llegada de MSI a México tuvo mucho que ver con el desastre del 2017.
The arrival of MSI to Oaxaca had a lot to do with the terrible earthquake. Since the end of 2017 until 2019, the MSI infrastructure was designated to support the disaster relief after the earthquake, especially in Oaxaca and in the city of Oaxaca and the other community that were most affected.
¿Me están oyendo? Sí, todo bien. Es que escuché ruido. Vale. Y entonces, ¿sí?
¿Dónde está? ¿Dónde está?
Hay un niño hablando al fondo. Hola,
Pueden poner apagar su audio si están escuchando.
La idea, bueno, de esta manera llegó MSI y digamos que toda esta
This is how MSI arrived
para apoyar el desastre de los terremotos.
To support following the earthquake disasters.
Estábamos en Oaxaca.
And so since late 2019, we were in Oaxaca, already had alliances with the Contreras Foundation, working with cleft lip and palate, providing support for nursing and other needs around cleft palate, also with Smile Train. And by the beginning of 2020, we had achieved, we were able to work through all of the legal and bureaucratic steps. And while we were getting all of that resolved, so we could begin to work together with Smile Train, we were able to do a trial of our infrastructure. We had the capacity to operate 4 patients per day, and we could have a total of 8 patients per day in the hospital and 40 a week. And through campaigns, we were able to do about 25 patients per campaign. And we were able to reach up to 150 patients a month. So this was a very ambitious plan. All of these patients were first-time surgery. And we were working with a very good team, orthodontic team. Then in February of 2020, the COVID-19 pandemic arrived. We were about to begin our programs at that point, but it was all postponed because of the pandemic. It was postponed until TBD. We had lots of meetings deciding what are we going to do. Everything stopped. But we took on the task. We had the infrastructure there. We had the mobile hospital. We had the support of MSI with 10 beds. And we had up to 6 beds of ICU capacity. So the Oaxacan Health Services contacted us to see if we could support them with complex patients. So we were supporting the COVID management with the state of Oaxaca. In August, the health services in Oaxaca called us to try to get started with the cleft palate surgery. But we had an infrastructure that was completely free of COVID. And that allowed us to go ahead with elective surgeries like cleft palate surgery. And we were able to keep completely isolated from COVID. So the Mexican Association of Cleft Palate had done excellent work. So they had made sure, together with Smile Train, that we had all of the elements to be able to go back to work. So we started. This all was launched in August. Of course, we couldn't open the first day and start operating. We had to go through the whole process of working with the health ministers, identify patients. So we were finally able to start surgeries in November. The first thing we had to do was disseminate, to talk about the work we were doing, to publicize. We needed to reach the population and the patients and let them know that our organization was offering these free services for all patients of all ages, if both primary and secondary surgeries. And so the communication team was working through different types of media, television, radio, and putting out PSAs, putting them up in the markets, reaching small communities. So for this infrastructure to exist, because of the high level of technology, we have we had the manager of our hospital had to make some adaptations. So our surgical capacity was divided in half because it was decided we should only have one OR operating at a time. And so in addition to disseminating and publicizing, we needed to get closer to the communities and be in social communication with them. And so Cristian Escamilla headed this outreach to the communities. It's a very complex state in terms of geography, economics. So we needed to have a team of people doing outreach, approaching the communities, convoking patients. It's a complex task. And because of COVID, we couldn't bring together a lot of families together in one space. And the MSI team, we're just 3 people. So we were doing evaluation campaigns of patients, external outpatient evaluations. So that way we were identifying and convoking and facilitating the families to come. From then until now, we have identified 160 patients through our outreach campaigns, including from very far away locations in the state. Many were also facilitated by the DIF, which is it's a Mexican social outreach and assistance entity. And they have contacts with a lot of families. And also through social networks, we were able to publicize and people heard about us from them. And then it's very important to have somebody who's coordinating with the patients. And that we were able to make connections through telemedicine type connections. First outreach and be in contact with the families by phone. We're able to identify and do a first evaluation, which patients could be candidates for surgery. If the patients live close by, they can come in. Otherwise, we have to do a remote consult. And if it is an in-person consult, we had to make sure we had everything to do it safely. So the initial consult was remote, very carefully following protocols to of course reduce any risk of COVID. And it's a long consult. It's not a quick consult. It could take a half an hour per patient. More than 90% of the patients that we found did turn out to be good candidates. But those who we discovered were not candidates because of other issues, that it was not safe to operate. Those we did not have do the long trip to come in. And then we explained before the 2 weeks before their surgery, we explained the very strict isolation, social distancing, before they could come in for a personal evaluation. Then they need to come, there's all the restrictions for them to come in. They have to use their mask, all the regular hygiene. They had to commit to following all the hygiene. We adapted our pre-op unit to use as an outpatient clinic. With different stations for the different consults that they had to circulate through, always keeping social distance. So the patients would come in and follow a circuit with plenty of space between people. So we're able to see through this cycle of consults about 12 patients a day. Some, maybe 12% didn't show up because of different barriers, but we're able to reschedule. So when they come for this in-person consult, they go through each of these subspecialties listed here. And then very strict use of masks, of hand sanitizer. And we did a deep clean between every patient coming through. And during this interdisciplinary consult, even though everyone who comes here, they're a surgical candidate, but some of them need pre-op orthodontic work. And we referred them to other care. And patients, when they come in, they bring in their blood sample. And this is a way that we monitor for anemia or malnutrition. And then we do any treatments that are necessary to correct that. And then there are other patients who need to have orthodontic work or orthopedic work first before they can do surgery, so that they can respond favorably to surgery. And we've made use of temporary shelters that are available around the city of Oaxaca, because it's impossible for patients' families to go home. Some are from so far away. So we have a location. It's kind of like a student dorms center close to the MSI facility. And they're able to have a room either with 2 single beds or with a double bed. Each room has its own bathroom. So the family is provided with meals. So the patients who come for a consult, they come for only 1 day, but those who come for surgery are there for a couple days. So it's an indispensable element to have this shelter where people can stay. So, another thing that is absolutely necessary is to have the PCR test. We were able to work with a private laboratory that was been able to donate this service, both for the team and for the patients. This guarantees the availability of the results of these tests 48 hours before surgery. So we have a whole system set up. If they come and they have the consult and they're in the shelter, and then everything is spaced out, and they have to have this test result 2 days before surgery. Every patient who's admitted to the hospital has to show this negative result, or they can't be admitted. Every patient was screened. There were 2 patients who did come back positive. They were both young adults, and they were asymptomatic.
Presencial, pasaron 2 semanas y cuando llegaron a hacerse la prueba de coronavirus salieron positivos, por lo tanto ya no ingresaron al campamento.
So those were not able to come into the shelter and get the surgery at the time. So our pre-op space we only allowed 2 patients. So there's really only 1 patient with their companion in each space at a time. So there's no sharing of spaces. There's this strict use of circulating through the process, so there's not overlap of people, in addition to the strict hygiene and masks, etc. We also updated the HEPA filters and anesthesia machines with all of this in mind as well. As part of the team, we have a thoroughly Oaxacan team. Dr. Nico's father as supported as anesthesiologist. Been working more than 20 years and is an expert in pediatric surgery and in designing a circuit. Dr. Martinez also is a fellow in Oaxaca in anesthesiology, in pediatric anesthesiology, and works hand in hand with a last year resident. And then it's a small team, a small young team. And then we have 4 wonderful angels in our nursing team, have known how to design and adjust and adapt the entire process of care, from the external consults, from the outpatient consults through all the care in the hospital. And our patients are in their best hands with this team of nurses. And these are women who have worked these last years with Smile Train and the Contreras Foundation. Our surgery team is also small, but very stable. I've worked very closely with Dr. Carlos Perez, maxillofacial surgeon. And so we've developed this excellent surgical team. Also with this young Felix Robles, his last year of dentistry school, but wants to be continue on and become a maxillofacial surgeon. He wanted to be a volunteer, but we incorporated him as part of the staff. So it's important to, we kept a minimal staff. So after 5 weeks of surgery, a lot of work, we were able to treat. It was just a lot of work to put this whole thing in March, all the preparation. We reached almost 40 patients, operating 5 days a week. 4 days of surgery, and then the final day is like high complexity dental surgery. We decided that it was some of the patients could not be immediately referred to surgery. They first need dental work. And then 1 day every week, we do an M&M evaluation, really evaluating our model and see how we're evolving every day. 2/3 of our patients are secondary patients. So sometimes we have to undo everything that was done in their palate, in their nose. A lot of them might need at least 3 hours of surgery. And even with the primary surgeries, sometimes we're talking about 2-hour surgeries. These patients need time and they need quality. Those it's outpatient surgery. The palate surgeries, they are discharged to the local shelter. We had one patient who after surgery fell on the face, and that was a bad complication. So we do continuous follow-up. There's a phone call and other regular contacts. So we are very impatient. We started doing this work in 2020 and we're hit by a pandemic.
Colombia, en México, donde no hay test masivos, es imposible de saber dónde nos encontramos en la curva, pero lo que sabemos es que...
But we're working in a country that there's, like many other Latin American countries, there just isn't a lot of testing, so we don't know exactly how widespread the pandemic is, so we were working within that.
De los pacientes que nacieron en 2020 más los que vendrán en el 2021 con una explosión demográfica posible,
But we know that there's a huge accumulated backlog now of patients. There's a tremendous population explosion, and we know there's a lot of patients. And so there's this backlog of untreated surgical patients. So we know that this is going to be even a bigger challenge for the lack of resources. But to summarize the MSI model, it's just a very interesting model. It can be adapted to the local needs. It's not imposed on the local needs, but it's adapted to. And we establish agreements, collaboration agreements with the local health system. And we can offer our infrastructure to manage localized disaster scenarios, or to help meet unmet needs. So now we've been working in COVID while maintaining quality and trying to do quantity as well. So the need is enormous, and we're giving it as much attention as quickly as we can. Thank you so much for your presentation, for all your great work. Very interesting, the connecting with all of the local healthcare system and the other organizations. I would like to open to questions. If anybody has any questions. You have two options. You can put your questions in the chat, or you can connect your audio and just ask. There was so much good content there. My question to start us off, seeing how much need there is, without understanding completely the breadth of that need, we know that there's a big need. Looking at everything that's needed for these patients, all the coordination work that's needed. There's a lot of organizations that want to work, they want to help. But we don't always know how to coordinate, how to unite our different efforts. What can you suggest so that we achieve a future where different organizations work together? I love the question. I think, for example, COVID it's opened these doors towards, we need great alliances, wide alliances to confront this challenge, to meet the needs in humanitarian surgery. It's really difficult to speak in the terms of global surgery as a generic thing. I think that's for the future, but in short term, the first thing is look for spaces that are free of COVID. Find and identify spaces that you can keep free from COVID, because COVID is going to be with us for a while. It's going to continue to limit elective surgeries. There are a lot of small private clinics small clinics that are doing elective surgeries. They are halted right now. But maybe different organizations can come together and bring their resources together to use that infrastructure in a space and developing a circuit that is kept perfectly free of COVID. Thinking, for example, of the Operation Smile initiatives. This is something we have to look towards the future and think of alliances between some of these big organizations. So Operation Smile, Smartering, those who have capacity to do big things, work together among different organizations through 2021, which is going to continue to be really difficult to work. The challenge we have is time and the overwhelming need. Is MSI thinking of expanding? Are you working only in Oaxaca right now, or are you thinking of expanding? Michael can probably answer that better. But of course, yes. MSI thinks big, but it has its feet on the ground. We're working right now in this area in Oaxaca, working with AMS. Really, this has been a trial of the mobile infrastructure, but it's taken by surprise many local health systems that have limitations, even in the developing world.
Sino adaptando la infraestructura a disaster relief.
So the MSI infrastructure, it surprised everyone. We've been able to adapt not only to the local surgical needs, but to disaster response. So we're working in short term and in limited. Well, we're hoping to reach a volume of 500 surgeries a year. But I think it is necessary for us to think big and expand step by step. Knowing Michael, he's not going to stop until they have 500 mobile units working. And also a specific question, how do you handle the COVID tests? Even a PCR test? Is the staff, the team also doing PCR, and at what periodic testing schedule? But also, Michael has a virtual tour of the technology that he can offer us.
Seré breve para la pregunta que hace Miguel.
With Galindo Laboratories, regarding the PCR testing, we have an agreement to be testing all of our team. So there's an academic and there's a philosophical debate. How often should we be testing? So we decided to not do the test unless we had a probable or known contact with someone, or there were some symptoms compatible with COVID. But this is something that needs to continue to be evaluated and change. The Galindo, the study is through a nose swab. So all the team will be evaluated again before we start work in 2021, but this is constantly up for debate. We'll see.
Vale la pena. Quizás es un momento también de compartir algunas de las soluciones, de los protocolos que distintas organizaciones mostraste, el que tienen con Smart Train y también la Asociación Mexicana de Labio Paladar Hendido. Quizás algunas otras organizaciones.
It might be interesting to hear from someone else what policies they're putting into place in terms of how the periodic schedule for their testing.
Nicolás, es la hora, son las 6, se nos ha ido el tiempo volando.
The time has flown here, but I wanted to open the floor if there's anyone else who had a burning question.
I had one question for Nicholas. You talked about the throughput rates, the number of patients each day. What's the limiting factor on that today? Is it the amount of space you have, the number of staff you have, the ability to identify patients and get them there? Is it money? What's limiting the rate today?
So it's because we're working as we do in a regular standard center fashion. So we work 8 hours per day. That's the thing. Our staff is hired for a full 8 hours per day session of work. So we start at 7 a.m. and we finish at 2:30 p.m. And we are now on the meantime of performing 2.5 patients per day each, sometimes 2, sometimes 3. And the thing is, expanding beyond that means that we have to expand our staffing, and I think it's not reasonable to do that at this stage. We want to assure quality and safety, and we're not here for short term. We're here for long. So I think it's better to go step by step. Our intention is, rather than expanding on cleft lip and palate procedures, we would like to bring, for example, other institutions like cataracts surgeons, orthopedic surgeons, hand surgeons, breast surgeons, teams that could use our infrastructure in the afternoons or in the weekends, so we can expand the use of the infrastructure for other neglected surgical conditions rather than expanding ourselves in cleft lip and palate conditions.
Thank you.
Muchísimas gracias, Nicolás. Bueno,
Thank you very much, Nicholas. This has been a lot of learning in this quick hour. Thank you. Thank you, MSI, Michael. A lot of lessons about collaborating. It's so good to see everybody. We've all heard lessons about collaboration, working together. Congratulations again. Thank you, everyone, for joining us today. Thank you to the organizing team. And we will see you again. There will be a presentation on February 2nd. Smile Train will be hosting. We'll be hearing from one of their partners. We would like to say on behalf of everyone at the G4 Alliance, we wish everyone good health, good success, and health for all your patients. Good night. Thank you, everyone. Goodbye,
Adios.
everyone. Thank you so much.
Thank you. Thank you.
Thank you,
Good night.
Nicholas. Thank you, everyone.
Thank you.
Thank you.
Thanks,
For
have a nice
everyone.
evening.
Y gracias a Jody por su interpretación, que hasta con las manos estaba interpretando también.
Muchas
Feliz
gracias.
2021.
Ay, feliz 2021.
Año, Happy New Year, everyone. El 2 de febrero nos vemos nuevamente.
Gracias.
Wonderful presentation. Michael, thank you for bringing Nicholas there. Jody, thank you for your wonderful interpretation. Ruben, thank you for moderating such an interesting discussion. Thanks, everyone, for joining us.
This was
Thank you
fun.
very
Thanks,
much.
That was
everybody.
great. Jody, what a remarkable thing to kick off so early in the history of the working group. Really, kudos to you.
Well, it was a team idea. Yeah. Thank you to everybody.
Thanks,
Okay.
everyone. Good
We'll
night.
be in touch. So good to see
Okay.
everybody.
Talk to you soon.
Stay
Bye.
healthy. Good night.
Bye-bye.
Bye.